Why do so many inductions end in an emergency caesarean birth? So I'm going to go through lots of different factors because it's never usually just a one size fits all. It depends on the piece of research that you pick up that will guide you as to why some of those caesarean births are happening. For example, if you pick up the ARRIVE trial, it will tell you that inductions do not lead to an increased chance of an emergency caesarean birth. But if you look at all the correlational data that we have, this is where books like Sarah Wickham, Inducing Labour and In Your Own Time are a fantastic resource. Can't recommend them enough to go and read. So I'll start with the most obvious one first. What is the reason that person is being induced? Sometimes that can increase the chance of an emergency caesarean birth. So as an example, I'm going to give growth restriction as one of those examples. If you're being induced for growth restriction, your baby has already had some issues with the placenta at some point within the pregnancy, reducing the oxygen. That means there's less fat reserves for baby during labour and birth. It means that the chance of fetal distress is higher, and that's part of the reason why stillbirth is slightly higher as well for babies who are growth restricted during their pregnancy. Particularly if they have dropped off the centiles, there are concerns with placental flow from the ultrasound scans. All of these things can have an impact. And if you've had a long labour, for example, you've got infection, for example, all of these things impact on the way that a baby copes throughout that labour and birth. Healthy, well-grown babies cope better with labour and birth compared to babies who have maybe dropped off the centile charts, managing the stresses by reducing their growth, for example, reducing the amount of waters that are around themselves, for example. So there are a few factors that can increase the chance of baby not being happy, and that increases the emergency caesarean birth rate. However, even in those cases though, it can be the chicken and the egg, because if you leave it too long before recommending an induction, for example, that baby is getting more stressed each day because that oxygen reserve is decreasing day by day. So it means that even going into spontaneous labour sometimes increases the chance of emergency caesarean birth, or a forceps or a ventouse, for example, compared to if you'd have been induced a little bit earlier. Whilst I would love a crystal ball, I don't have one sadly as a midwife, but that would really help to tailor when the right cut-off times are for individual women. Now the next thing is to think about the methods of induction of labour. There are different types of ways of inducing labour. You have got the cervical ripening stages, you have got mechanical, you have got hormonal, you've got the breaking of the waters, and you've also then got the oxytocin drip as well. Thinking about the hormonal versions of helping to open up and efface that cervix, there's an increased chance of that uterus contracting too much. That's very similar to when the hormone drip starts. If the uterus contracts too much, the cord is getting squeezed a lot, that reduces the oxygen flow to baby, that can increase the chance of fetal distress. Contracting the uterus too much also means that the woman is more uncomfortable, a lot more pain, more likely to need an epidural, for example. And the epidural itself, whilst it doesn't have a link with increasing caesarean births, it does increase the chance of ventouse and forceps in that pushing stage. We've also got to think about the other risks of induction of labour. Sometimes it can be that by breaking the waters, there could be a cord in front of that baby's head. Maybe there was a reason that person didn't go into labour and birth. I've done a video before on does induction actually lead to a caesarean birth, or is the reason behind coming in for an induction always going to lead to a caesarean birth with or without that induction of labour? And then we've also got to think about the other side effects. So sometimes inducing labour can increase the chance of bloodstained liquor. Induction of labours require multiple vaginal examinations. The more vaginal examinations a woman has in labour in general, the higher the chance of developing infection. Infection can lead to an increased chance of an emergency caesarean birth. And over 5 vaginal examinations in labour is associated and correlated with a much higher chance of the woman developing an infection and the baby developing an infection. And then we've also got to think about the psychological impact of inductions of labour in general. We know that just going to a hospital can slow down labour. Women need to feel safe, secure, comfortable, relaxed to be able to help their parasympathetic system. So labour works by being in the most relaxed optimum state that you possibly can be. If you look at any other mammal, they'll go into a dark corner and they'll labour on their own in that dark corner because it helps to promote their parasympathetic system. We were not designed as humans to go into labour in stressful situations in our fight-flight response. Adrenaline is produced and so is cortisol. They are hormones that block oxytocin in general. And it's part of the reason why home birth has a lower amount of interventions, a higher positive satisfaction rate from women, but also helps to promote a little bit of a quicker labour and birth, but also getting that baby into an optimum position. Now, in an induction of labour, there's that psychological impact where you are in a hospital, you are on somebody else's timeline. things are a little bit more outside of your control. You're often with members of staff you've never met before, there's often a changeover, and sometimes you can be in for days. That cervical ripening stage could be anywhere between 30 to 50 hours potentially, even before you get to the point of breaking your waters, and even before you get to the point of the hormone drip at 12 to 18 hours on average. And you've also got to think about the lack of sleep in that time. So if you've been woken every 6 to 12 hours for monitoring, for example, if you're next door to someone who's quite noisy, loud, if you're in a bay with other people who are snoring and keeping you awake, you're already entering labour and birth in a slightly more stressed state and stressed environment because of that lack of sleep in the run-up to labour and birth. And we've also got to think about the other aspects of induction of labour from the perspective of fetal monitoring. Fetal monitoring in general restricts mobility of women. If women are more restricted from a mobility perspective, their baby is more likely to stay in less than optimum positions, whether that's slightly skew-if, slightly asynclitic in the pelvis, whether that's back to back, for example. All of this can slow down labour, increase the amount of interventions, and if there is a developing infection, it means that you haven't got as much time to get to fully dilated before that infection starts having impacts on both you and your baby. And so it's what's known as the cascade of interventions, like a little snowball coming into the hospital or having an induction of labour, and it just snowballs because it's often multifactorial. It's never usually just one thing that has led to that emergency caesarean birth. It's often a range of different things, whether that is the environment, whether that is the psychological impact of coming in and having less control, for example, whether that's the actual medications themselves that have caused some side effects, whether it's the processes or the length of time. It's often lots of different things that feed into an induction being correlated more with an emergency caesarean birth. And I have to say correlated here because the ARRIVE trial that came out highlighted that there was a decrease in emergency caesarean births, but it's the only randomised controlled trial that has found a decrease by offering a induction at 39 weeks. And so it poses a lot more questions rather than answers because firstly, the samples, they weren't representative of all women. You've also got to think about the method of inductions that were used. What else were they doing to actually influence those outcomes? There's far more to unpick than that, but from a correlational perspective, we do know that inductions are linked to more caesarean births. We also need to think about the decreasing gestational age that women are offered induction of labour at now. Years ago, you were not offered an induction until you were at least 2 weeks, if not 3 weeks overdue. And that has steadily come down as time has gone on. And dating scans have come in where they overestimate the dating length of babies at between 11 and 13 weeks. And that's why we know that some women who maybe have had IVF implantation know exactly when they've conceived, have gone for their 12-week dating scan. They know their dates off by heart and suddenly they've advanced by a week or two. Due dates vary by individual person, they can vary by ethnicity, they can vary by our medical history, they can vary by our genetics about what our parents did and how long their pregnancies went. And instead we have arbitrary dates and arbitrary times where we recommend induction without weighing up what is right for each individual person because we don't have the level of research to recommend different gestational ages for different people. And with increasing litigation and stillbirth rates, that gestational age has come down and down and down. Now that is increasing the amounts of neonatal unit admissions that are happening for care afterwards with respiratory distress and TTN. We also know there's a link between individual medical history and the increasing caesarean birth and induction labour rate. For example, we are seeing more women with complex medical concerns and issues, more women with diabetes, more women with raised BMI, and more women who are older having their first babies. And all of these factors can impact on the pregnancy, on the baby growing, for example. It can also impact on the chance of going into labour. We need far more research, far more evidence in this area. But it's also thinking about the amount of women now who are also developing high blood pressure at much earlier stages because of the lifestyle genetic things that are coming through. And finally, maternal fear. We have seen an increased amount of women who maybe there is some slight fetal distress in labour and birth, and women are going, I don't want any risks at all because of the maternity scandals, I just want a caesarean birth now. And so that's another factor that has influenced.